Thanks to all of the media that have tuned in and are joining us today. The presentation that we're going to go through today is the culmination of bringing together these two iconic organizations. Obviously, we needed to bring two web platforms together, so you're going to see that. We have some partners with us, some collaborators. I see that our responsibility as the National AIDS Memorial is to convene and bring people together. So we have Ann Balsamo, who is the developer of the AIDS Touch Quilt, and she'll go over some of that when we take a tour of the new web platform. Cleve Jones, activist, AIDS Memorial Quilt founder and friend of the National AIDS Memorial. Dr. Huma Abbasi, who's General Manager Global Health for Chevron, and who have partnered with us now for nearly a decade and is an instrumental partner in the telling of the stories. As we look at this and we go through an overview of the new web platform, it truly has become a new program of the organization. We're launching this platform this week as a backdrop to the International AIDS Conference that is in the Bay Area. And unfortunately, the conference had to go virtual. So we do not have the nearly 30,000 delegates in San Francisco and Oakland, but we are announcing this and launching this today because the conference is here, and the conference is about action, and the conference is about stories, and that's what we are doing. For the last 40 years, since 1980, AIDS has been a part of all of our lives, and we've lost so many, but at the same time, it has galvanized the community and individuals to come together across our nation. For 4 decades later, we're still sitting here without a cure. I myself have been living for over 2 decades with an AIDS diagnosis, and we do not have a vaccine, nor do we have a cure. We've lost over 700,000 of our fellow citizens, friends, and loved ones over that period. And at the present, over 1.2 million people are living with HIV and AIDS in this country. Earlier this year, we culminated the joining together of the AIDS Memorial Quilt and the National AIDS Memorial. The Quilt was created 32 years ago, 2 years before the AIDS Memorial was created, and just a short 2 miles from where it was created. I've always looked at this as the opportunity of 2 early twins that were together and then went their own ways, and they've come back together to continue to do the powerful work. Memorials are about memories, and memories are about never forgetting. And the way that we never forget is we continue to tell the stories in perpetuity. And that's been the power of what the Quilt does, and that is the power of what the National AIDS Memorial Grove has done, and that it will be the power of the future. The lessons we can learn today from the AIDS pandemic and what we face today with COVID and social justice issues and lack of government response are powerful, but it also allows us to look and showcase and highlight the response of individual citizens who are reaching out and bringing about profound impact in their communities and helping their fellow citizens, as was the case during the darkest days of the AIDS crisis. Joining together these two organizations and these two memorial projects will forever tell those stories. Our hope is that through the new web platform, we can share stories over the last 40 years of the AIDS pandemic. Those lives lost, the survivors, the heroes, the activists, and yes, the agitators, because that is part of what is in the fabric of our nation, is to ensure that we challenge the base of power to bring about profound change in our society. And I believe that today we can the citizens can look to this nation to do so. What I would like to now do is turn over to Kevin Herglotz, who has truly been the visionary around this new project and this new platform, to take you on a tour, and then we'll come back and have some conversation and questions and answers afterwards. Again, thank you all for joining, and thanks to the panelists that will be speaking today. Kevin?
Great, thank you, John. I am going to share my screen and show you a video presentation of the new web platform. Hopefully everyone can see that. Ann Balsamo, who is with AIDS Quilt Touch, the AIDS Quilt Touch team, is going to help walk through this with me. And then following that, John will introduce and have Cleve speak, and then Dr. Abbasi from Chevron as well. So we'll just start with the front page of the new platform. As you can see, this is very visual and very storytelling. It highlights all the programs that the National AIDS Memorial has, but really is focused on the front page about stories. Our 2020-40 initiative we're launching today, as well as the AIDS Memorial Grove and the Quilt. When you go into the 2020-40 series, we're launching that with snapshots of 21 faces of AIDS from the beginning of the pandemic 40 years ago to today. You can see on there, for instance, one example is this is a panel and a story about Gary Legrand and David Wiles. The archives behind the quilt, the friends who wrote letters and talking about their story, you can see those there. The Library of Congress, through our partnership with them, are archiving all of these records and are to make them available to the public, so you can see a sampling of that on our website through that story. You'll also see, you can see Reggie Williams, a story of Reggie, who was one of the activists throughout the AIDS movement and has a quilt panel as well. You'll be able to see stories like Marcy Frazier, who was a nurse at San Francisco General in the AIDS ward during the darkest days of the pandemic, and hear from her and see stories that are in the public domain, such as this with the Washington Post, that really share the grief that she went through during that time. Then you'll also see stories like Cleve Jones, the founder of the Quilt, and his vision and his story, and listen to podcasts and see videos or read some of his publications that he's had out there. So, and then you'll also see some of the faces of AIDS today, like Antoine Matthews, who is a board member at the National AIDS Memorial, but he's also an activist and very much involved in social justice issues, particularly in communities of color. Each week, these stories will be refreshed. We'll add new stories in, so the idea is that people can come back and we can keep sharing stories. There are so many stories and faces of AIDS to tell, and through this 2020-40 initiative, we're hoping to bring a fraction of those stories to the forefront. Then if you go back to the site, like I said, you can see we highlight our two iconic treasures, the National AIDS Memorial Grove, and you can learn about its history, see videos, podcasts, and the story about the Grove and how it came about. The other iconic treasure, as we talked about, is the AIDS Memorial Quilt. You can see, again, a lot of digital media on here about the quilt, its history, and of course today we're launching the interactive AIDS quilt. And on that, I will turn it to Anne to talk about that experience that you'll see on the platform.
Thank you, Kevin, and thank you so much for the opportunity, not only to be able to present this kind of experience, but also to be able to get it into the website, and which is the first time in 20 years that the idea we started with, which is a browsable, kind of easy to use image of the quilt that would enable people to see not only the kind of the full array of the quilt, but also kind of move to work and look at different details literally stitched into every panel. So what you're doing right now is kind of moving in and out, zooming in and out of the digital kind of image of the quilt. It is comprised of 6,000 photographs of individual quilt blocks. A block is usually an 8x8 kind of collection of kind of individual panels. This interactive, or this image, wasn't easy to do from the very beginning, but it was something we knew could be done technologically, but we needed some expert programming, and we got that help. with some funding from the National Endowment for the Humanities. So this is a project that's almost 20 years old now, and is really a kind of collaboration among humanists and technologists and artists who have pretty much done the work because it's been a passion project and because they're committed to doing their work kind of in the service of social justice. So, long-going project, the first time now on the National AIDS Memorial site that it'll be available for people other than the few of us to see it. So what you're seeing now, this digital image is about 25 gigabytes or gigapixels. Those technologists out there will understand how big this is because it represents kind of high resolution images of a textile quilt that would cover 1.2 million square feet if it were laid out in its entirety. And one of the statistics that got us started on this was that if somebody only took 30 seconds to view each of the 48,000 panels, it would take them more than a month to visit each panel. So this is an affordance that the digital offers that can't do with the kind of the textile quilt easily. But from the beginning, this project was motivated by the sense that we could use these digital tools to augment the cultural importance of this incredible work of cultural heritage. So if you look at Marvin Feldman's name is in the search bar at the very top. What you'll see then is this, we've searched for the name, and you'll see kind of multiple red ribbons kind of showing up where we move then into a close-up of Martin's name on one of the blocks. He's actually mentioned on 6 or 7 blocks, but this is block number 006. His panel also shows up on the very first block, 0001. And just to let you know that this virtual or this digital quilt image, the blocks are arranged in kind of roughly historical order. So this is also a historical digital document, visual document of the quilt. Here you're searching for Reggie Williams' panel that Kevin mentioned earlier. And if you'll see the difference in kind of images towards the end, that's because our digital imaging technologies got better. The early images were photographs. The later images were kind of digitally. One of the names I think you just searched for is Ryan White. And here you'll see that the search capacity is still really crude. You'll see Ryan, kind of the kind of red ribbons kind of across the image. Many of those are panels dedicated to the young man Ryan White, but you'll also see that it returns the word Brian White. So one of the projects, one of the sub-projects that we are going to be working on now is with a kind of community sourcing application. We're going to work on cleaning up the name database that associates names with quilt kind of panels, so that when we search, people get to the name that they're actually looking for, or they get to the block with the best information that we have about the kind of the people commemorated on the panel. So that's a brief overview. Instructions on how to use the interactive page, the interactive application are available. And because we're also interested in using this as a prompt for stories, we're asking people to share your commemoration, your stories, your reactions to the Instagram, Facebook, Twitter accounts of the National AIDS Memorial. So thank you, Kevin.
Great.
Thank you. Kevin, if I might just briefly, thank you, Anne, for touring us through that. It's truly a dynamic, high res. It's amazing, and the connection that it would take, a month for people to view 30 seconds of every panel is just phenomenal. I just wanted to also make sure everybody is aware, when we acquired and transferred the stewardship of the quilt over, there were over 200,000 archival documents that came with the quilt. Everything from letters and birth certificates, death certificates, up to and including remains of individuals that have directed the quilt to, at the time when the last life is lost, to bury those remains. We entered into a relationship and a partnership with the Library of Congress. We did not give up the rights to these amazing documents, but what we've done is we provided them to the largest open source library in the world. And as was shown earlier, they're being digitized, they're being cataloged. And the power of the relationship with Anne and her team and Dale is that when those are digitized, not only will there be those ribbons that will be on panels, but there will also be an indicator of what panels have archival material attached to them. Not only archival material that's been generated over the last numbers of years, but as Anne just asked, is individuals leaving notes and messages today and those stories going into the future. So that's the power of the future. That is keeping it alive, and that is telling the story. So thank you, Anne.
You're welcome.
And so I will take you through just a few more features on the website. You can learn there about the programs of the National AIDS Memorial, such as our Pedro Zamora Scholarship, our Mary Bowman Arts and Activism Award, hear more about her story, as well Surviving Voices, what Chevron, through their support and funding, has made that program happen. And this year, we will have featured 100 surviving voices through that program. And then you can see another big piece. The National AIDS Memorial receives all its funding and support from private donations and partners like Chevron, Gilead, our partners at Vivint Health. And here, what we've done on the website is try to bring their stories to life in terms of why they're involved with the National AIDS Memorial, the work that they do every day in supporting the AIDS community and with their employees and their team members. So you'll get to see a little bit of that when you visit the site as well. And that is our quick overview of the website. That is the main page where you'll see a welcome message from John. So on that note, I will turn it back over to John to introduce Cleve.
Great, thank you, Kevin. Just before I turn it over to Cleve, I think that for all of the media that are here and listening, the National AIDS Memorial is the only federally designated memorial to AIDS. And with that comes a profound responsibility to ensure that the tragedy that we went through, but also how we rose up and how we brought about change, will forever be captured, curated, and preserved for future generations. So that's the power, that's the responsibility, that's what we do. And I'd now like to turn it over to Cleve Jones, who has been obviously at the forefront not only of HIV and AIDS, but of the LGBT movement for decades. So Cleve, thank you so much for joining us.
Well, thank you, John, and I'm very grateful to you and your team at the National AIDS Memorial. I'm just so grateful that the quilt is home and that it's being used again. And before I say anything else, I want to acknowledge the role that Speaker Pelosi and Representative John Lewis played in that, our partners from Chevron and Gilead, to all of the volunteers who have stayed loyal to the quilt. What I'm really struck by are the parallels between what we're facing now with COVID-19 and what we faced the nightmare that began 40 years ago. I was working in the California State Legislature, working on health issues for the State Assembly when I saw that first report out of the Centers for Disease Control and the Morbidity and Mortality Weekly Report 39 years ago last month. You know, within just a few years, almost everyone I knew was dead or dying or caring for someone who was dying. And one of the things that frightened me and led really to the creation of the quilt was my fear that all of these people would just disappear, that their stories would not be known. And my friends were such remarkable people, and I wanted them to be remembered. And so that was really the genesis for this project. Now, when we look at the complexities of COVID-19, there are just so many parallels. The importance of testing, the significant racial disparities that we're seeing, the importance of community action, the difficulties, the challenges of persuading people to modify their behavior in ways that can save lives. So I think it just underscores that this quilt still has a role to play. And I'm grateful that it has found a home where people understand that value and intend to use it. The quilt was never intended to be a passive memorial. The quilt was about revealing the lives and the humanity behind the statistics. It was about shaming a government whose inaction had created such a catastrophe. It was a tool for the media to help them understand how the disease was spreading and the communities that it was affecting. So it was never intended to be just a passive thing. And today, as we see people hoping for a vaccine, hoping for a cure, it brings back a lot of very painful memories for me. And I think all of us, I know, John, we've discussed this ourselves, that this is just bringing back a lot of really, really difficult memories. But those are exactly the memories we need to keep in the front of our minds right now as we endeavor to face this new challenge. So to everybody that's worked so hard on this, Anne and Kevin and the whole team there, I'm just really very grateful to you, and to our corporate sponsors. It wouldn't have happened without Gilead. Chevron has been such an incredible partner throughout to so many AIDS organizations throughout the Bay Area, particularly the San Francisco AIDS Foundation. So I'm really grateful to all of you. Thank you very, very much.
Thank you, Cleve. As Cleve said, there are so many lessons and the thread can be pulled from one pandemic to another. And, it's all about leveraging the relationships and making sure that what we're doing is honoring the lives that were lost, because that is what is at the core of our work, is to ensure that the work that we do honors those lives lost that we are memorializing, and making sure that they were not lost in vain. Partners have stepped forward for decades. Chevron was one of the earliest partners to step forward courageously and taking risk when it was not comfortable nor safe at times for the corporate community to step forward. But it is the courageous leadership of organizations such as Chevron and others that have continued to bring about impact, not only in the Bay Area, but also globally. Obviously, Chevron is a global corporation, and their commitment to the health of their communities in which they do business is critical. Our work, and most specifically, the work of the storytelling projects that we've been working on, could not be possible were it not for Chevron's commitment. Chevron has committed to making sure the stories are always and forever known. So I'd like to turn it over to Dr. Huma Abbasi to share some of her remarks. Huma?
Thank you, John. Good morning. It's an honor to be here with people like yourself. You guys are truly heroes who are continuing the message and the fight against HIV/AIDS, which is very, very important to us too. I want to first start by congratulating National AIDS Memorial for being the steward of the quilt, and Gilead for being such a strong partner for bringing back the quilts to San Francisco, which I think is a really great event. And just remembering that this is a very powerful historical tool for storytelling, and about HIV/AIDS, about racial inequality, about destigmatization and social injustice. And at the same time, it's such a beautiful piece of art that I feel that needs to be shared with the generations to come. As you're aware, Chevron has been in this fight for more than 30 years. And we were also involved in building the quilts in the Names Project, first in 1993 and 1997. And then from then onwards, every year we have built quilts. Depending on the themes, we have a group of Chevron retirees and Chevron employees who are very passionate about the programs and have the skills to develop these quilts. And we've had quilts on themes like hope, like AIDS is going to lose, like getting to zero. One year, I recall, we had a quilt celebrating the success we had by having HIV negative babies born to HIV positive mothers. So these are the important stories that we need to tell to continue the fight. I'm also very proud of a long supporting partnership with the Surviving Voices storytelling project. And now this 2020-40 project looks very promising, and it continues to raise the awareness and visibility that we've had with those projects. These stories remind me of all the journey that we have had and the stories that I've heard over the years from Chevron colleagues, our employees, our friends, and the families, people who have lost their lives to this devastating disease. And also it helps us celebrate the lives of individuals who are living with HIV and have had access to healthcare. So it is very important for us to continue this journey, support our partners to build this program. Every time I remember these stories, I do recall 2 years ago when we joined the Surviving Voices project for Asian Pacific Islander community. And there was a story that came to light about a family who lost their son to one of their sons to HIV and another to violence. And that was such a heartbreaking but an important message to bring forward to the other generations. Then last year, we had a focus on the transgender community, another community that is underserved, marginalized, and does not have proper access to healthcare. So all these stories help us remember the things we need to do, the focus we need to put on these global health priorities. I just feel like now more than ever, and Cleve mentioned that about the COVID-19, as you're aware that now we are all facing with this pandemic, but we cannot forget the other pandemic, HIV/AIDS. The fight is, it's not lost, but it continues. And we need to put our focus on these priorities like HIV/AIDS, tuberculosis, malaria, the programs and successes we've had. And it's about storytelling. It's about continuing our journey and supporting our partners to make sure that we don't lose ground on the successes we've had in the past. I also feel like this is also a time to, when we had the AIDS 2020 come to the Bay Area, San Francisco, Oakland, to remember the lives that we had lost here in the 80s, continue to tell those stories and reflect and continue the journey. We are committed partners. I think that a lot can be done when we bring together the right skills, the right partnerships. We have a long history with public-private partnerships and foundations like San Francisco AIDS Foundation, like the Grove. And I feel like once we have these shared goals, the mutual agenda, and collectively, when we bring these issues forward, we will be able to fight this disease and really get to our goal, which is getting to zero.
Thank you so much, Huma. And again, thank you, Anne and Cleve, for your participation as well, and Kevin for your moderation. I just want to close by, as we sit here today, 40 years into the epidemic and the countless lives lost, for all of us on this panel, as well as everybody that's listening, to redouble our efforts and to commit to ensuring that we carry the lessons and the memories forward to this present day. As Cleve and Huma shared, we do have a pandemic we're in the middle of right now, and there are lessons that we can carry forward to bring about solutions. And I think the most profound one is for us to ensure that we stand up and that we take action and become activists as we were back in the day, to hold our elected officials and our government responsible for the inaction that they are taking at the present time for stigmatizing a virus, as was done in the early days of the epidemic. So thank you all again for being with us. Kevin, I'll turn it back over to you.
Great. Thank you, everyone. I will just start reading some of the questions and that we're receiving, and then ask the panelists to respond as appropriately. Our first question is, for how long has Chevron been involved with the Quilt? Dr. Abbasi said it had been over 30 years. Could you provide a little bit more detail of that involvement and engagement?
Yeah, so our fight on HIV and our journey began in the 1980s, where San Francisco, which is our home, was struck by this devastating disease. And 15 years ago, we actually had a groundbreaking policy, an HIV/AIDS policy that informed and developed workplace program on education, awareness, destigmatization, anonymous testing, and providing access to healthcare. We joined the Quilts project in 1993. We developed a quilt, and then in 1997. And then from then onwards, every year, we had some of our employees and retirees come together and develop quilts on different themes, different projects. We've also brought these quilts to different countries. As you're aware, Chevron is a global company. We are multinational, and we have operations in some of the countries like West Africa, where really we have disproportionately women and especially women of color impacted by disease. So we have brought these quilts to those countries and shared stories about the Chevron journey, about Chevron employees, the families and colleagues whom we have lost to this fight. And since then, we, every year on World AIDS Day, we had a program at Chevron headquarters, and we proudly display these quilts and use these quilts to share our stories, because these symbolize our past, present, and the future.
Great, thank you. We had another question about searching the quilt and asking if you can search the quilt by panel maker.
Yes, Kevin, thank you for the question. I think this is from Bill. Right now, we know that the search by name and the search by block number works. And there are other search categories, what we would call parameters, that we would like to implement. So panel makers, because that is of importance to the people who have done not just one, but many panels. The other, I think the other question that we get a lot when we display kind of this version of the quilt, like in exhibits or or at the Names Project, people want to know where their quilt has traveled. So I think there is another search, search option we'd like to implement with it, which is we have the records of where all of the panels have been on loan or on display. So I think we could augment our search capacity to do that. I think there are certainly other kind of obvious search terms. Year of birth, year of death, city of significance, I think is another one that people are very interested in, because when we do an exhibition, for example, kind of in Dallas, we not only display the interactive quilt, the digital interactive, but we also display textile quilts. So for as often as we've displayed kind of the interactive, either on a screen or on a touch table, we always try to do it in proximity to the textile quilt, which means then we have to go into yet a different database to find quilt blocks and panels that would be of significance to the people who might come and see the exhibition.
That's great. If I might briefly, thank you, Anne. So we have what we call panel maker cards for all of the panels that have been made. And I think it's important for everybody who's listening to realize that the technology where we are today was not present then. So all these cards are on literal cards. So this is a project that we continue to look at and we continue to work. We do have at our fingertips where all the panels have been. And so this will be a matter of being able to continue to collaborate and work with both Anne and her team, as well as the Library of Congress, to take it to the next level and to go back for funding to the federal government or to others through the Department of Humanities in that vein. The other thing that I think is important that we're looking at, as Anne has also discussed, is that we're looking at utilizing crowdsourcing. So we can bring individuals in to this process, and they can begin a process of helping us to continue to tag the quilt, so that we do have the ability. We curate for most every display. One of our employees, Brian Holman, who's been with the organization for over 18 years, curates, can go in and search by demographics, by region or area, and therefore create a display that is going to be profound and impactful for the particular community in which it's going.
And John, we've developed a very rudimentary app that we considered a genre of community sourcing, because I think what we want to do is call the people to participate who have kind of values and mission alignment with this, right? As well as the family and friends and those young ones who are coming to the quilt for the first time.
And then, like we pointed out on the presentation, what you can see when you go to the interactive quilt page on the website is we are really going to drive a lot of this storytelling on social media. So to add to those the archival collections are stories and memories and items that are shared via Instagram with the hashtags of AIDS Quilt and National AIDS Memorial, so we can build the online archive that goes along with the treasured history of the quilt as well. I have another question here. I'm getting them on multiple sources. How is the quilt being displayed during COVID? John?
So, you know, as I had indicated, we were blessed that the quilt arrived and was shelved at the end, put on all of the shelves in its new home at the end of February. And we were blessed that it made it here before we went into shelter in place. We had plans with the city of San Francisco that we would be doing the largest display in the history of San Francisco, as well as a display that was basically equal in size to the first display that was going to be that was held in Washington, D.C. So at the present time, the quilt is going out on limited basis, because normally the quilt would be displayed for large gatherings, whether it was Pride or other purposes. And so we've had less display requests. We are still available for people and groups to request it, especially as we head towards World AIDS Day. Again, that's another wild card. We don't know exactly how World AIDS Day will play out for all of us around the country and around the world relative to gathering, as has been the case in the past. But the quilt is available. We take requests on an ongoing basis, and we actually set up a fairly large display in a restaurant in Seattle over their Pride weekend a few weeks ago. So it's been limited, but we are still here to serve the community to bring the quilt out.
And then just to add to that, John, too, is on the website you can see where it is currently on display, and if you there's also the ability if people want to host the quilt or request the quilt be a particular panel be on display when it comes to a city around the country, then people can request that as well, and the team we'll look at that and consider that. Another question, I think this is for Cleve, that came in is they showed the quilt, the panel of Marvin Feldman. Could you share a little bit more about that first panel in the beginning?
Well, I often say that you know, there are many quilts for Marvin Feldman, and all but one are beautiful. He would have been, I think, quite disapproving of it. Marvin was quite picky. He would have wanted something that could have been displayed at the Museum of Modern Art, or at least Bloomingdale's front window. But I think it was interesting, as Anne was walking us through it, that you can see the chronology. The early quilts, a lot of them were made on, you know, just spray paint and old sheets. And then gradually, as the idea took off, more and more artistry came to play. I remember, you know, some of those first ones that came in really just blew our minds. They were so beautiful. So every time I see poor Marvin's panel, I think, well, it's a shame I didn't do a better job of that one, but I miss him dearly. You know, I still think about him every day, and his mother is still alive. She's well into her 90s now, and she and her whole family have expressed repeatedly how grateful they are for the quilt to keep Marvin's name alive. Members of their family traveled to Washington to be with us for the handoff ceremony and at the Library of Congress. And another thing, Marvin's quilt has traveled so far. And when Anne was telling me that, telling us that we're going to have the capacity of telling people where their quilts went to, I just think that is such a marvelous idea. About a year ago, I had the opportunity to travel to Cuba for the first time and was able to bring quilts for Cuban Americans and Cubans from our country to be joined with quilts there on the island at a ceremony that was held in a sanitarium where people with HIV had at one time been confined. It's now an intentional community, and it was just such a moving experience to see these quilts united. And kudos to you, and I can't wait to see that happen. I would love to know all the places my Marvin's been to.
There's a similar question, probably for Cleve. From Marvin's panel, the question is how many panels or names are on the quilt today, and did you ever think it would create such a movement, Cleve?
I don't know how many names are in the quilt now, so someone else will have to answer that. But
well over 125,000 individuals are memorialized within the quilt.
Thank you. You know, I had this idea a year and a half before we started it. I had the idea of a candlelight memorial for Harvey Milk and George Moscone the week that the death toll in San Francisco hit 1,000. And I could see it in my head. You know, I could just see it. I could see the National Mall covered with fabric, but nobody else could see it. And another thing that was going on in my mind at the time was having to disclose that I was HIV positive to my grandmothers. I was the first grandchild in our family, and my grandmothers loved me very much, and I think both would have done anything to save my life. And I kept thinking about how I wanted there to be a place in the movement for them. The quilt was started the same year as ACT UP, and many of us who were part of the early years of the quilt also participated in ACT UP demonstrations and civil disobedience. But I knew that my grandmothers weren't going to put on a black leather bomber jacket and get arrested at the FDA. One of the most wonderful things that happened with the quilt was it wasn't just about seeing that picture in my head become real, but to see how the quilt and the Names Project became an entry point to the movement. People would come to us, people from all over the country, places where ACT UP and the other activist groups could never go. And it brought them in. And first it was making a quilt for their family member or friend or neighbor who had passed. And then it would progress from that to being an active volunteer in one of the service provider organizations, and then the letter writing and the campaigning. And I have no way of knowing how many, but I'm quite certain that many tens of thousands of people joined the movement against HIV/AIDS through the Names Project AIDS Memorial Quilt.
Thank you, Cleve. I have one other question. Why the emphasis on storytelling, the 2020-40 messaging around that? John?
Well, obviously 2020 equals 40. It is the 40th anniversary of the epidemic. And as we indicated at the outset, the AIDS Memorial Quilt was the first memorial project, and the AIDS Memorial Grove was the second, and they're now joined together. So I think it is fitting and appropriate that as these two entities come together, as I said at the very outset, a memorial is about memories, memories are about never forgetting, and never forgetting is about keeping the stories alive. And so I can't think of a more profound way of not only honoring the bringing together of these two entities, but those lives lost. So that's what is our responsibility. Our responsibility is to keep the lives and the memories alive, and that's through storytelling. You know, we in so many ways have lost the face-to-face storytelling, especially during these days of COVID. but it is a matter of leveraging technology. That is where so much storytelling is going on, and that's what we're doing, and we'll continue to build this into the future. I think when individuals really go into this 2020-40 and start looking at the stories of the individuals, as was shared earlier, it's not only perhaps a story written about Cleve, but then it's also an ongoing building of other assets that will tell the deeper story of the individual, what they've done, where they've been, because that's how future generations will understand not only what happened, but about the individual lives, because that's where individuals can be inspired. And we've got to continue to inspire future generations to get off the sidelines and to bring about profound change in the communities in which they live, because that's our responsibility as human beings and members of the community. And so I feel that these stories and the dynamic nature of this new platform will accomplish that.
I would just like to add to that, this isn't just about nostalgia. The issues that presented with the onset of HIV/AIDS are still with us. We're dealing with them right now. And so I think that these storytellings, it's not just about remembering people and honoring them. It's about learning the difficult questions, the difficult choices we made. And one of the terrible things about HIV is that it really, there was a real, so many people lost their lives and their stories vanished with them. And so I think that with this new platform, we're going to be able to offer people a lot of very useful information, way beyond just remembering people and family members, but useful information about how individuals and communities struggled and adapted and fought back and learned and grew. So I'm just very excited about all of this, and again, want to express my gratitude to all of you. And there was one person I don't think who was mentioned yet today, but let us not close this out without remembering and thanking the ever awesome Gert McMullen, who sewed this quilt together and is still sewing it and using our surplus fabric to create masks for people on the front lines of the new pandemic. So thank you, Gert.
And Gert is one of the first, stories on 2020-40, along with Cleve and others. So you can learn more about her there as well. John, we don't have any more questions. I think, do you want to close the press briefing?
Sure. Again, I want to thank everybody that joined us, both from the media side as well as all of our partners. This is just the start, and the National AIDS Memorial is here to answer questions, to spotlight. If anybody that is out there has a story that they feel needs to be added to this ongoing building platform, please provide it to us, because we are the keeper of the stories and we help tell the stories, but by no means do we know all the stories. So we look to you to help us to keep this dynamic platform alive and then form future generations. So again, thank you all.
Great. And you can visit www.aidsmemorial.org and learn more. Thank you so much for attending. Thank you, everybody.
Thank you.